Acute idiopathic polyradiculoneuritis in dogs, also known as Cologne disease, is a neurological condition that can be frightening for pet owners and veterinarians alike. This disease, which affects the peripheral nervous system of dogs, can have a sudden onset and cause a variety of debilitating symptoms. In this post we talk about this condition, including its causes, symptoms, diagnosis, treatment and long-term outlook for affected dogs. What is acute idiopathic polyradiculoneuritis? Acute idiopathic polyradiculoneuritis is a neurological disease that affects the peripheral nervous system of dogs. It is characterized by inflammation of the nerve roots and peripheral nerves, resulting in a variety of neuromuscular symptoms. This disease is also known as Canino disease due to its higher incidence in dogs of Canino breeds, such as the Redbone Canino, the Blackhand Tan Canino and the Treant Walker Canino. Causes of acute idiopathic polyradiculoneuritis. Despite being a serious disease, the exact cause of acute idiopathic polyradiculoneuritis in dogs remains unknown. It is believed to be an autoimmune disease in which the dog's immune system mistakenly attacks its own peripheral nerves. Bobler syndrome in dogs. What is it and how can it affect your canine companion? Dogs are part of our family, and when they face health problems it worries us deeply. One of the lesser known but serious neurological disorders, Bobler syndrome causes. Although not all causes of Bobler syndrome in dogs are fully understood, it is believed that there is a genetic predisposition in certain breeds, such as the large 2. Stiff neck. Dogs with this condition may experience neck stiffness and difficulty lowering their head or moving it laterally. 3. Difficulty getting up. You may notice that your dog has difficulty getting up after lying down and may show that it is Bobler syndrome in dogs. Bobler syndrome, also known as cervical spine disease or cervical spondylotic myelopathy. It is a neurological condition that mainly affects large or giant breed dogs. Symptoms of Bobler syndrome. The symptoms of Bobler syndrome can vary in severity and may include 1. Ataxia. Ataxia in dogs refers to a lack of muscle coordination, which causes the dog to have difficulty walking and maintaining balance. 4. Frequent trips and falls, due to lack of coordination. Dogs affected by Bobler syndrome will often stumble or fall more frequently than normal. 5. Pain. Some dogs may experience body pain. 1. Medical treatment. Medical treatment may include corticosteroid therapy to reduce inflammation and pain, as well as physical therapy and controlled exercise. 2. Surgery. In severe cases, surgery may be necessary to relieve spinal cord compression. Prevention and long-term care. If you have a breed predisposed to Bobler syndrome, you notice early signs of the disease. Prevention and long-term care are essential. Make sure you provide a proper diet and avoid being overweight, as excess weight can aggravate the condition. Recognizing the symptoms and seeking early diagnosis and treatment are essential to improving your dog's quality of life. As a responsible owner, your role is to protect lumbar function. In some cases, a lumbar puncture may be performed to test the cerebrospinal fluid for signs of inflammation. Nerve biopsy. In severe cases or where definitive confirmation is needed, a biopsy of an affected nerve may be performed. Once the diagnosis has been made, the veterinarian will be able to determine the best treatment approach for the affected dog. Treatment of acute idiopathic polyradiculoneuritis. Treatment of acute idiopathic polyradiculoneuritis focuses on reducing inflammation and supporting the dog's nervous system. Treatment options may include corticosteroid therapy. Corticosteroids, such as prednisone, are commonly used to reduce inflammation and suppress the normal immune response. Intravenous immunoglobulin. IVIG in some cases. IVIG may be administered to modulate the immune response. Physiotherapy. Physical therapy and assisted exercise can be beneficial in helping the dog regain muscle strength and coordination, nutrition and supportive care. It is important to maintain adequate nutrition and provide supportive care, such as fluid administration and monitoring of the bladder and intestine in case of incontinence. Pain management. Analgesics may be given to relieve pain associated with the disease. Treatment may be necessary for weeks or even months, depending on the severity of the disease and how the dog responds to treatment. Regular follow-up with the veterinarian is essential to evaluate the progression of the disease and adjust treatment as needed. Long-term perspectives. We are talking about a disease that can be serious and debilitating for affected dogs. However, many pets can experience a gradual recovery with proper treatment. Recovery may be slow and some dogs may experience permanent neurological sequelae, such as residual weakness or problems. Coordination. It is important to provide ongoing care and support to these dogs to improve their quality of life. Despite the facts mentioned about this disease, with early diagnosis and proper treatment, many dogs can recover and lead happy, healthy lives. If you suspect your dog might be showing signs of this disease, it is crucial to seek care. Vet immediately to increase the chances of a successful recovery. How long can a dog with senile dementia live? Most common diseases in boxer dogs. Congenital diseases in dogs. Understanding and addressing a canine health challenge. Rheumatoid arthritis in dogs. Understand and address this debilitating disease. Acute idiopathic polyradiculoneuritis in dogs. A clinical challenge. Thanks so much for looking. I hope the video has good information. To see more videos, like and subscribe to my Obsolution channel. Press the bell icon to see new videos first.